lithium disilicate does have some translucency to it, I want to try the restorations in using a try-in paste, because the color of your cement can have an effect on the color of your final restoration. And I want to use the try-in paste because that's going to show me what the color of my cement, what kind of effect the color of cement will have on the final restoration. But also the nice thing about the try-in paste is they will create a little bit of retention for the restoration while I'm evaluating it. So I'm evaluating fit, margins. I'm looking on the lingual side, making sure I'm happy with how everything fits there. And then at this point, I'll hand the patient a mirror and say, okay, this is what they're going to look like when we get done. Do you see any changes you want to make? Are you good for us to go to the next stage of cementing these into place? And this is an important part in an anterior case, because if the patient wants any changes, we need to know now, because some changes I can make in the mouth, other changes have to go back to the lab. All of these try-in pastes are water soluble. So just an air water spray, aggressively rinse off the try-in paste. Now, we need to decontaminate the internal aspect of these veneers, but the modern, easy way of doing it is one of these two products on your screen. Last thing we're going to do before we cement these into place is we're going to re-silinate the internal aspect of those restorations. Now, at the lab, your lab should be silinating the restorations before they send them back to you. Double check with your lab, but any good lab should be doing that already. But the idea behind resilinating is, one, it can't hurt. And two, it may increase your bond strength 10 to 20%. Isolating the area, we're double checking for hemorrhage. Okay? And if we're seeing any hemorrhage, we go back to our retraction paste or our hemostatic solution and control that. Really important at this part, because you don't want to get to the etch part and find out you got a bleeder. So we're going to place all of our etch, let that go about 20, 30 seconds. And then our bonding agents, we have a lot of different options, but right now, and probably for the last 5 to 8 years, universal bonding agents, like the All Bond Universal, is what most of us are now using. I'm going to use a light cure resin cement. And the reason I like light cure is, one, the veneers are so thin, I'm confident that a good curing light will penetrate through the porcelain and completely bond or completely cure my light cured resin cement. The other option is a dual cure resin cement. Okay, so 1, 2, 3, these are 3 of them. This is a light cure resin cement, the choice 2. If you like dual cure resin cements and you've got your favorite and that's how you want to put in your veneers, that's great. Just understand the clock's ticking as soon as you start to extrude that, and you got to work fast. If you've got really good retention and resistance form, you are totally okay to use this. But if your retention and resistance form is compromised, that crown is being held in large part due to the bond strength of your bonding agent and your cement. And it's documented that dual cure resin cements categorically, okay, I've got 2 Bisco products up here, but I'm talking about entire category. Categorically, if you etch, prime, and bond and use a dual cure resin cement, you are going to get better bond strength than if you just go to a self-etch, self-adhesive resin cement.